So does diet play a role in autism spectrum disorders? So autism spectrum disorders is a heterogeneous condition that spans from from mild Asperger's symptoms to completely incapacitating compromise of mental function. And it's almost certainly due to different mechanisms that have been studied in great detail. Genetic heterogeneity, so some forms of autism spectrum have different vulnerability genes than others. But there is evidence, for example, that the diet of the pregnant mothers and obesity of pregnant mothers, which we now know is associated with this low-grade immune activation, can be a risk factor for development of autism spectrum disorder in the offspring. This is a disease that starts in utero. You can observe brain changes already before the child is born. It does not start with birth. The big question is, once the baby is born on this trajectory, can a dietary intervention attenuate or slow the progress of the disease? And that question has really not been answered yet by any definitive study. A lot of desperate parents have tried all kinds of diets, including ketogenic diets, gluten-free diets. But there's not enough data to date that we could say there is a reliable dietary or that we have a possibility of reliably influencing the course of this devastating disease. There are therapies, promising therapies, that target the microbiome independent of diet with fecal microbial transplants. So there's one pretty impressive study now that has shown an improvement after fecal microbial transplant in children, both in terms of the gut microbiome changes and in terms of emotional and cognitive function. And that effect has been sustained over 2 years. So one could speculate if you can change symptoms, slow disease progression with a manipulation of the microbiome, there is a theoretic possibility that a certain kind of diet that does the same thing as a fecal microbial transplant may also be beneficial. But we don't know the answer to that intriguing question.